Breast reconstruction is performed for women with breast cancer, and many of the reconstructive procedures I do are performed in conjunction with a surgical oncologist who treats breast cancer. So I will often immediately reconstruct women who are undergoing mastectomy procedures or breast removal procedures at the time of surgery, so that they can wake up after surgery and look down and see that something is still there, that they're not without something. And traditionally, I'd say in the 70s, women had delayed reconstructions so they could appreciate their deformity and appreciate the reconstruction that much more, and that is just not the case nowadays. That's a ridiculous philosophy. So we're seeing women in their 30s who are gene positive, who are seeking protective mastectomy and reconstruction, and certainly we see the full age range of patients. The very exciting aspect of breast reconstruction today is that we have wonderful implant options, and implant-based reconstruction really comprises about 85% of breast cancer reconstruction cases. So in some cases, we are actually able to do the immediate breast reconstruction on the table to the size that the goal is and maintain the nipple areola, which we hadn't been able to do in the past. So women actually look like they just had breast augmentation. It's incredible. And it's very fulfilling for me to be able to do that. There's another group of women who would prefer to have their own tissue for reconstruction rather than use implant-based reconstruction. This is about 15% of women, and primarily we use the abdominal tissue for that. What's the benefit of that? Well, number one, the tissue ages with you, it's your own, and you get a tummy tuck out of it. What are the cons? It takes a little longer to perform this operation. It takes a little more recovery, and you know, with the gains, there are often some bigger potential risks associated, but we've been doing this type of surgery frequently since the mid-80s, so this is a very safe alternative as well.